Okay, we are now recording the webinar. Thank you for joining us for the October Strengthening Families Networking webinar. We are going to focus today on promoting family engagement and specifically how states are using strengthening families in their quality rating and improvement systems. So a quick overview of today's agenda. I will share some updates from CSSP. Normally we hear updates from the National Alliance of Children's Trust and Prevention Funds, who are our co-sponsors for these webinars, but none of them were able to join us today to share those updates. So I will be sharing one update from them, and then we'll get into our topic on promoting family engagement. I'm going to give a little overview, and then we'll hear from two states about how they are using strengthening families in their QRIS. We'll hear from Erin Armbrust in Wisconsin and from Jane Zinc in Idaho. And then we'll have a discussion that we hope you will jump in on as well. So as we go, please feel free to type in questions. Or once we get into the discussion time, you can raise your hand and we will unmute you. Raising your hand won't work if you just do it physically where you are right now, but if you do it in the webinar panel, we will be able to see that and we can know that you want to be unmuted to ask a question. So I'll give a couple quick tips or some information about these webinars and then some tips for the webinar software. We do issue an open invitation to folks who are using the Protective Factors Framework, and always welcome you to share the invitation with others who would be interested in the topic. And we are always happy to have folks, whether for whatever level you're engaged in strengthening families with, if you're interested in the topic, please join us. I mentioned that we convene this, my organization, the Center for the Study of Social Policy, along with the National Alliance of Children's Trust and Prevention Funds. And we take turns coordinating the topics and speakers. We welcome volunteers. If there's a topic that you are really burning to share information about or lead a conversation about, please contact me and we can work that into the schedule. Recordings and materials from past webinars are always posted at the site listed there, and the link to that is always sent out in the Strengthening Families e-update newsletter that comes out the second half of the month. So you can always check for that, both for the registration link for the next webinar and for recording of the previous one. So a couple webinar tips. If you're having trouble with your connection, you might want to switch which audio mode you're using. You can always listen through the microphone or through the speakers on your computer, and if you're speaking, you can speak into the microphone on your computer, but you can also dial in. So you can switch through that. If you're having trouble, you can type in a question, and Trish Hallmark is with us from the National Alliance of Children's Trust Funds, and she may be able to help you solve your problem. I would also recommend the universal solution. You can always hang up and call back in and see if that helps. Okay, I want to share what upcoming webinars we have. We're really getting such great topics coming through. I'm very excited about this. In November, on the 12th, we'll be talking about the prevention of child neglect specifically. That's from the Alliance. December 10th, we'll hear about how folks are reaching family, friend, and neighbor care providers with strengthening families. That's going to be coordinated by Nina Cesar O'Donnell. And then in January, we will hear about a protective factors approach for CASA training. That's the court-appointed special advocates in the child welfare system who receive training. And we're going to hear about how in Idaho, they have incorporated protective factors training for CASA volunteers and how they have changed how those CASA volunteers are reporting back to the family court on family progress. Very exciting stuff. If you feel like you'd like to make a contribution in one of those webinars on those topics, please let me know. I can put you in touch with the person coordinating that webinar. Okay, I'm going to share some updates from CSSP. I guess I didn't introduce myself at the beginning. I'm Kaylin O'Connor from CSSP, and let's just jump right in. We have some really exciting news this week. It was announced that Boston Children's Hospital Brazelton Touchpoint Center will be housing the new National Center on Parent, Family, and Community Engagement. It's a federally funded resource center serving both Head Start and child care. The Brazelton Touchpoint Center has held that contract for supporting Head Start specifically for the past 5 years, and this is a new grant that expands the scope. And CSSP is one of the partners in that grant, along with Child Trends and Child Care Aware of America. So we're very excited about that. More information will definitely be following, but we're excited to be a partner in that, trying to support as child care and Head Start try to improve how they're doing their parent, family, and community engagement. So very relevant for today's topic of conversation, and something we'll be coming back with more information about soon. Another announcement from CSSP is that we have a new module available in our scripted curriculum about strengthening families. These are tools we're making available on our website. One module is being released each month for a total of 8, so we're halfway through now with the 4th module just coming out in September. That one is on trauma and brain development, a protective factors approach. I think that it'll be really interesting content for many of you to consider incorporating in different trainings that you already do. So this is not a full curriculum package that we're intending people to put into use as a whole, but rather tools that you can pull in. We're hoping that child welfare training academies and others will take some of this content and run with it. Each module includes slides, a script, and some activities to help participants learn the material, and they're all posted on our website. Again, we share a little bit about each one as they come out in the Strengthening Families e-update newsletter. One thing that I'm really excited about in this module and that I think you will all appreciate, it's basically, if you see the list of learning objectives here, it goes through the basics of what a very high level but summary information about early childhood brain development and adolescent brain development, and what we know about the effects of abuse, neglect, and other kinds of trauma. But then what's very unique to this training is the ending of it, which is a protective factors approach for caregivers. So for each of the protective factors, we look at it through a trauma lens and say, what does a caregiver need in a situation where they're caring for a child, whether it's their own child or if it's a foster child or a grandchild. If you're caring for a child who's experienced trauma, how is your resilience affected and what kind of support do you need? How are your social connections affected and what kind of support do you need? So we go through that for each of the protective factors. I think it's an interesting lens that helps to bridge some of the conversations that we know are going on in all of your states about trauma and trauma-informed care and adverse childhood experiences, and helps to bridge between that and the strengthening families and protective factors and prevention conversation that we're used to having. So I hope you'll all check that out, and I hope you'll find it useful. Please let us know if you have questions about how you can use it, but we really want you to use those slides, use the script, put it in wherever it can be useful. Okay, and then I have one announcement that's really from our partners at the National Alliance of Children's Trust and Prevention Funds. They convened the Birth Parent National Network, and in November they'll be hosting a virtual convening about parents' roles in transforming systems. These look to be some really interesting 2-hour sessions spread throughout the month of November, and they're open to Birth Parent National Network members. So if you know birth parents who would like to get involved in advocacy and systems transformation, please have them go to this website, join the Birth Parent National Network, and then they can participate in this virtual convening over these 3 dates in November. Very excited to see how that is going to go. It's such a great idea, and they're going to have really good content. Okay, those were all the announcements, all the updates. Now we're going to get into our topic for the day, which is about how states are promoting parent engagement using strengthening families in their quality rating and improvement systems. So I'm going to start with a little bit of an overview about why we focus on QRIS. We really have seen QRIS become a driving force in improving quality in early care and education, especially with the race to the top focus that's required states to develop some sort of QRIS as they receive those funds. So it's been an important driving force. It's formalizing and helping to further professionalize the field, giving parents more information about how to choose high quality, and in most states it's directing child care subsidy to higher quality programs so that those children who are eligible for subsidy, who we know are often among the most vulnerable children, are more likely to be getting into the highest quality care, which is what we'd all like to see happen. So within those QRIS, parent engagement is one component of quality. We know there are so many standards about what quality looks like in the classroom and even in the facilities and in the health and safety, and all of those are really important components of quality, and parent engagement is one piece that is getting more and more attention, which we think is a great idea, obviously, from a Strengthening Families perspective. And we think that Strengthening Families offers a really useful framework that helps early care and education programs figure out what they can actually do to better engage and better partner with parents. And we're interested in seeing how states are using this, how it's working, how providers are responding to it. So just in case you haven't seen it, in 2013 we did release an issue brief about how states were using Strengthening Families in their QRIS, and we did a webinar along with Build about that topic. So if you want to look up that information, it's on the part of our website that's about systems. So if you go to strengtheningfamilies.net and click on Systems, Implementation in Early Care and Education Systems, you'll find the information about quality rating and improvement systems specifically, or you can click on the link here. So we had done that issue brief in 2013, but things changed pretty rapidly as funding streams change and as states revise and update their systems. So we wanted to check back in on what states are doing, and thought this webinar was a good chance to share some of that information. So we did a brief survey of the 17 states that have told us they're using Strengthening Families in their quality rating and improvement systems. Just in the last couple of weeks, we did this little survey and 14 states responded. So I'm going to share results from this very preliminary survey, and then we'll have more information to follow as we, also as this resource center gets going on parent, family, and community engagement. It all ties together. So of the 14 states that responded, we asked just what the current status is of their QRIS. So one state responded that's just designing and drafting their system. One state has their system designed, but it hasn't been implemented. I think that's the case in several states, but this one is the one that also has Strengthening Families in it. And then in 5 states, it's currently being implemented without any major changes planned, but you see the majority, half of the, or the largest response, half of the respondents said it's currently being implemented, but it is under revision. Then we asked about which strategies were part of their approach. So just trying to get a big picture view. The most common strategy was to encourage providers to get Strengthening Families training. But you'll see, so that was 8 states, but you see 5 states actually require the Strengthening Families training for a certain rating. So if you want to be a 3-star program, you need to have a certain level of training or have a certain number of staff or percentage of staff attend a particular training. And I think our presenters are going to share a little bit more about what some of those details look like in their states. Then we have 4 states that encourage the use of the Strengthening Families self-assessment tool, and 4 states that require the use of the self-assessment to achieve a certain rating. In 4 states, they require a Strengthening Families action plan to be completed. So that's once a program has completed a self-assessment, they can create an action plan identifying places where they want to make some changes and really spelling out who's responsible and what the timeline is and all of that. So giving it more teeth of not just that you've assessed your current practice, but that you have a plan in place for improvement. And then in 5 states, Strengthening Families and protective factors are one of the areas that providers can get technical assistance. So there are specialists who provide that technical assistance, and they, in those states, have training in protective factors and in Strengthening Families, and it's part of what they can support providers in when they are getting quality improvement support. I see a question has been typed in about whether Washington State is using QRIS, and yes, Washington State is one that responded to this survey, and we won't have a presentation from them today. I'm not sure if anyone from Washington was going to be able to be on today. I mean, from the QRIS, from the Department of Early Learning. But if they are, I hope they'll jump in and share a little bit about what they're doing. Okay, another question we asked was which providers are subject to the Strengthening Families parts of the QRIS? And this is the difference between center-based providers, family child care providers, and informal care providers. The informal care providers are the least involved in QRIS in general, and so that holds true here. But I believe it is actually, I think it's Washington State that is the one that has licensed informal care providers, and they are part of their quality rating and improvement system. But for center-based and family child care providers, you see the green bar represents that all licensed providers are subject to the QRIS. The blue bar is only programs that are receiving subsidy have to participate in the QRIS, and the orange line is that it's completely voluntary. The gray is that none of those providers are required. So just interesting to see the spread across different types of programs and how, I guess it's really an indicator of how widely it's being used. If it's only those who get subsidy, then that will get a certain subset. But if all licensed providers have to do it, then you're able to implement some quality improvement on a wider scale. Just a couple other insights from that survey. In half of the responding states, the providers are encouraged or required to use the online version of the self-assessment. So that's the Strengthening Families Evaluation Portal. And in one state, they have adjusted their QRS requirements based on the fact that our new self-assessment that was released last year has a tiered structure. And 4 states are considering or working on those kind of modifications. Those questions, I think, didn't even make sense to some of the respondents because they hadn't heard about our new self-assessment. And so I wanted to take a minute today, since you all are interested in quality rating and improvement systems in order to be on this call, just to talk a little bit about what's going on with our self-assessments in case you hadn't seen the news about these things recently. So about a year ago, we released a set of 4 new self-assessments for programs. There's one for center-based early care and education programs, one for family child care programs, then there's one for home visiting programs, and one for community-based programs such as family resource centers, parent education, clinics, really anything else that's delivered in a community setting that's serving children and families. In each of these self-assessments, as an update from the older version that you may be familiar with, in the new version, for each of the protective factors, we list out the everyday actions that programs can be taking or that staff can be taking, and the self-assessment includes items related to each of those everyday actions that are listed in the boxes across the top of this page. Excuse me. So the previous self-assessment focused on program strategies, and this time it gets more concrete and ties more closely into the protective factors themselves rather than that program strategies scheme that we had used before. And particularly relevant for QRIS involvement, the self-assessments that are for early care and education are actually tiered. So what that means is in the family child care self-assessment and in the center-based one, we have items at multiple tiers reflecting different levels of engagement or different levels of effort being put into parent engagement. So for both of them, there's a baseline. These are things we think any program could be doing or should be doing to engage parents. Then with the center-based, we have 4 levels. So the second level is having more attention to parent engagement. Then we have one that's high attention to parent engagement and support. And then the top level is really for comprehensive service programs like Head Start or joint programs that are a family resource center and an early care and education program that have the capacity and staffing to really support families beyond what a typical early care and education center could do. For family child care, there's 3 levels. There's the baseline, the mid-level, that's a more intentional focus on supporting and engaging parents, and then at the highest level, that's a high level of focus, and again is probably most likely to happen in centers or programs in someone's home that are receiving systemic support. So probably not just an individual startup family child care, but one that might be part of a network that's able to provide more support both for the provider and for the families that are using the system. So we did it that way when we were revising the self-assessments because we knew that states were wanting to use the self-assessment as part of their quality rating and improvement system, but we're having a hard time with delineating, how do you say what star level you get beyond just did you complete the self-assessment or not, but sort of how did you rate yourself? Were you doing enough of the things that are included in the self-assessment? So trying to make that a little more clear we put those baseline items that might be what you would say you should be doing to achieve a certain star level. Those high level items that might be what you'd say if you're doing these, it's bonus points kind of thing. So I hope that more states will take a look at this over time and think about how it could merge better into the quality rating and improvement system and be a way of making it more concrete and more action-oriented. So there are specific things that the centers might identify they're going to start doing because that will get them a certain star rating, as opposed to this long list of items that might be hard to differentiate which ones are most important or most feasible for programs to do without a large investment. So that is why they're tiered. And also supporting programs being able to use this tool and having it feed into larger systems. Our partners at Mosaic provide the Strengthening Families Evaluation Portal. This is an update of the old online system that was called GEMS that some of you may have used. This one was launched about a year ago, and it includes all 4 of the self-assessments as well as action planning support. It actually will help you identify the items in the self-assessment that you want to pull into your action plan and then give you the prompts to put in your timeline and other details about what you're doing with those action plans. It includes, at this point, the protective factors survey. It will also later include the other survey for parents called the Parents Assessment of Protective Factors. And it includes a staff survey about how well they feel they're implementing protective factors with the families they work with. And it generates reports. So that is free for programs to use. There's a fee for administrative access. If you, as a state level system, wanted to require all of the programs to use it, then you would pay a fee on an annual basis to have access to all of their data, to be able to have oversight of who's completed what, etc. So that's provided by our partners at Mosaic. I encourage you to go check it out and ask them for more information if you're interested. Okay, so ways you can learn more. There's a lot of information and the self-assessments themselves at our website under the program section, Aligning Practice with the Protective Factors Framework. You can download the self-assessments there. You can also create an account and explore the system at strengtheningfamiliesevaluationportal.com. And then hot off the press, actually this was just posted today, we have a recorded webinar about how to use the self-assessment and how to use the Strengthening Families Evaluation Portal. That is at the link there. We'll be also putting it on that same page where the self-assessments can be downloaded. It's not there quite yet, but it is in the Media Center section of our website. So if you want to have a walkthrough of what the self-assessment actually looks like, how to use it, how to use the online system, that's a great way to get an orientation. It's a 40-minute webinar. And I see a question has been typed in. Are we able to see the practitioner and staff survey? At this point, you would only be able to see that by going into the Strengthening Families Evaluation Portal. But if you send me an email, I will get a copy. I'll send you a copy of it. And that was one that was developed, just to give you a little backstory, it was developed led by Illinois, their Strengthening Families initiative. During the pilot phase of Strengthening Families, when there were 7 pilot states, they got folks from a few other states to work with them and to pilot it. And it's a pretty brief survey, but definitely something worth considering. Okay, so we are now going to hear from 2 states. First, Erin Armbrust from Wisconsin, from the Department of Children and Families, is going to tell us about Young Star. Erin, are you there? We don't hear you, Erin. Are you muted? Erin? Okay, I'm not able to hear Erin. I think what we will do is...
I think what we'll do is manually mute her and then unmute her and try to
okay. All right.
force the system to let us let her talk. Erin, could you
Hello.
try again? Hi, there you go.
Hi.
Beautiful. Thanks, Trish. All right, Erin, take it away.
Okay. I was like, I'm not muted, I swear. Okay. Hi, everybody. So my name is Erin Armbrust. I work at the Department of Children and Families. I work under the Race to the Top grant as the Family Engagement Analyst for Youngstar. So that's me. Kaylin, you can go to the next slide. Perfect. So Youngstar does a few different things where we encompass strengthening families framework. So the first thing that we do is our family engagement required point. So prior to just a few months ago, our family engagement point was an optional point that programs could choose or not choose to encompass in their program. And so it was very minimal. It was 6 options. One was, to have an annual conference with parents, so they could get, a little check mark for that. They had to do 2 of the 6 things in order to earn the 1 point. This year I spent 7 months revamping this point as a guideline for Race to the Top, and so it now has almost 40 options in 5 different categories, and the categories are, community relationships, transitioning of children, that kind of thing. And so Strengthening Families Framework heavily influenced this document. So we took the self-assessments for program strategy 1, 2, 3, 4, and just sort of laid them all out on the table. I had a wonderful working group of professionals from all around the state that helped me sort of dive into this, what looks best for programs, what's feasible for our programs, and what some of our programs are currently doing, so that we're encompassing everything. And so we just to give you a few examples of the self-assessment form program run strategy that is incorporated into this a required point. So the program provides opportunities for families to socialize and foster a sense of community, such as periodic events like coffee breaks and breakfasts, celebrations, graduations, holidays, field trips, and activities outside. So why not the exact language from the assessment is in this, it is so very close that you would recognize it as soon as you saw it. There are just a number of places throughout this indicator that the Strengthening Families approach is highlighted. So that just heavily influenced this required point. So it was optional until a few months ago where it became required. So all of our 3-, 4-, and 5-star programs must have this point in order to sustain that star level. So we're really proud of that, and it's really important that our programs are engaging families effectively. Okay, the next one. So the next one, this is an optional point. It's in our health and well-being section, and this is where we highlight the Strengthening Families training. So I talked a little bit prior to this to make sure I was on the same page. So Wisconsin, and from what I understand, a few other states have sort of taken the big Strengthening Families training and sort of adapted it to what works for their state. So in Wisconsin, we have a 3-hour training, and it has the mandated reporting piece built right into it, and the 5 protective factors. And so this training can also earn you a point if 50% of the staff has taken this training. So you sit through the training, and then you get the point for this. So you can choose to do it and choose not to do it. So the same working group that worked on the family engagement required point also tackled this point, because we feel that in Wisconsin, sort of just to sit through a training and to not have implementation within the program is not where we'd like our quality programs to be. So in the future, we're hoping that sort of like what Kaylin talked about, where the program assessment team is developed, and then they have the self-assessment action team where they take the self-assessment and then they go through and sort of say, this is our action plan. And so the program self-assessment team will consist of the administrative staff or program director, an early child care teacher, a family support staff person if that's applicable, and then a parent. Best practice would be, one parent from each of the age groups that your program serves, but at a minimum, one parent must be present. And then for family child care, it's the program owner and then one parent or a parent from each age group. And then that's really just, and we'd like to showcase that for 3, 4, and 5-star programs as well. And so we're hoping that that can be implemented into our program in 2017 when we go through and sort of take a look at our points and our language and best practices and new research and keep our QRS up to date. Okay. And then the last thing we provide in Wisconsin tons of resources for our providers. And because family engagement turned into this, went from 6 possible things that you could possibly do to an enormous 40 item required point thing, we wanted to have something really solid to provide them around sort of how do you effectively engage families in your programs. And so this working group developed the Family Engagement Guiding Principles, and it's 13 guiding principles, and it was heavily influenced by the Strengthening Families framework. It's just a resource that we want to provide for the early child care programs when they're looking to sort of beef up their family engagement in their program. And so I think that's
Great.
it. That's what we do.
Yeah. Thank you so much, Erin. And I just want to clarify, the training that you referred to is one that was developed in Wisconsin, and I think several other states have used that as a basis of developing their own training, as well as other states have developed their own training. But we were talking before about how that connects and is different from the big training, the certified trainer training for the National Alliance training on bringing the protective factors framework to life in your work. So this one is a separate, shorter one, which I think many states have, that was developed as more of a conference session or one-off training to give an overview of the framework. Let me just check. We had one question typed in. Someone was asking about whether it's possible to get a copy of the guiding principles you mentioned, Erin. Are those posted on DCF's website?
So right now I am working with our Forms and Pub people to see if it needs to be like a publication or if it needs to just have a form number for DCF protocol. And so as soon as they give me the go-ahead, it will definitely be on our Youngstar website.
Okay, great. And maybe once that's out, you could let me know and we can let the network know.
Absolutely.
I'm sure other people would like to see it too. And I'm also sure that we have a lot of state employees from around the country on the phone right now who are nodding when you say, do we need a pub number or a document number or whatever it is. We all know how these bureaucracies work, but we'll get the good content out one way or another.
Yes, this document is something that I'm really proud of. It's really clean and concise, and I would be happy to share with the network.
Wonderful, thank you. All right, our next speaker is Jane Zinc from Idaho, who's going to talk about steps to quality. Jane, are you on?
I am, thank you.
You actually sound really quiet. Can you speak again so we can make sure we're able to hear you?
How's this? Better?
Oh, so much better. All right.
Okay, great. All right, so there I am. My name is Jane Zink. There's our city, Boise, and I'm the QRS coordinator for the state of Idaho, as well as the Strengthening Families coordinator. And I work for Idaho Association for the Education of Young Children. So I think that our QRS looks a lot like many other states' QRS. There's a training component, technical assistance, an improvement plan, various standards and indicators and steps. In Idaho, we have a building block model with 6 steps and programs. It's a voluntary model, and programs can come in when they're licensed, and then the 6th step is national accreditation.
Jane?
Yes.
I'm really sorry. Someone said they still can't hear you well. Can you get any closer to your mic?
Well, I think that this is probably it. I don't have a mic, I just have a headset.
Okay. Okay. Well, all
Sorry.
right. Yeah, just
I can talk louder.
you can. Thank you.
Okay. And so Idaho is on its second version of QRES, and we have built from the original version and this one always with strengthening families as the designated parent engagement piece. So I have some boxes on this slide if you'd hit the button, Kaylin. There we go. So our strengthening families is embedded in all aspects of our QRES. In Idaho, we have an essential training series. So it's 14 to 19 hours of training for each step of our quality rating and improvement system. And of that training series, there are 3 hours of strengthening families in each training series. And then the information that's received in the training is measured in the quality indicators. We have our personnel, our technical assistance personnel, regional quality child care consultants across the state. It's in regional offices along with child care health consultants, and these folks deliver technical assistance to child care programs, and they're all trained in the framework. Each program in Steps to Quality then works through an improvement plan, and the name of our standard for strengthening families is Strengthening Families and Communities. Okay, I think it's the next slide. So our essential training aligns with the standards and indicators, and let's see, next button. And there are all of our standards: health and safety, staffing and professional development, child growth development and learning, strengthening families and communities, and leadership and management. And like all QRSs, I think sometimes it's hard to differentiate what indicators need to go in what standard. There's a lot of overlap between child growth development and learning and strengthening families and communities. So we try to recognize that within our technical assistance as we're applying the framework. The essential training is also incentivized. So as an individual person through our professional development registry, there's an incentive attached to completing the essential trainings. And if you're working in a program that's a QRES program, the incentive is higher than if you're not working in a program that is enrolled in the QRES. We have 4 essential training. So in step 1, or the essential training 1, it's an introduction to strengthening families. These are all 3-hour trainings, and there's an option to be taking the alliance training or a certain number of hours of the alliance training in lieu of the strengthening families introduction, which is an in-person training. The second ET is sharing leadership, partnering with parents, which really focuses on that partnering piece. Our third essential training is called Responsible Adults, Safe Children. And then the last one is Committing to Strengthening Families. We also have a resource called a checklist of practice. It says caregiver strategies and what they look like in practice. And this is, again, a document that aligns with the training content and the quality indicators. It acts as a training review tool. It's used in technical assistance and kind of also functions as a self-assessment. And we have programs use it in staff meetings and other internal processes. We also have some other resources that really seek to link the framework to training, and also to emphasize how child care providers are uniquely positioned to promote the protective factors. And here's one of those. It says intentionally planning a conference using the protective factors. So we're trying to develop more of these materials so that we can talk about using the protective factors in the day-to-day life of a program. And then this last slide just shows how the essential trainings line up with the steps and the indicators. So in essential training 1, kind of supports basic health and safety, including prevention policies and annual training in child abuse and neglect prevention. In step 2, we're really talking about partnering with parents, communication strategies, and self-assessment. Essential training 3 focuses on communication systems and engaging parents through educational and leadership events. In essential training 4, which is about partnering for parents, we really look at a program's ability to partner with their community, to have conferences with parents, and to engage parents in feedback and program development. And then the last indicator before last level before national accreditation on our QRIS requires a parent board or some other kind of active participation by parents that actually influences development of the program. Again, conferences, and then reference to the protective factors in strategic planning and evaluation. We don't have an essential training 5, but in the past we've had a strengthening family specialization, and we're in the process of reworking that so individual child care providers could receive a specialization in applying the framework in their work. So that's my contact information if you need it.
Thank you so much, Jane. That was really interesting, and I love the level of detail there. I'm going to pose a couple of questions, and I hope that other people will also jump in with their questions.
Okay.
I saw that one person typed one in, and Trish, you're going to need to help me because I lost it. I read the question, and then it went away. Can you find it? So we'll see if Trish can find that and read it to us. But I'm going to ask a broad question about how decisions have been made or are in the process of being made about how to promote parent engagement through QRIS. What has that conversation been like in terms of parent engagement being part of the QRIS, and then how to measure it?
Well, I think that it's always been, actually the decision to include parent engagement in the QRS was probably made before I was here, but it's just been a commitment that we've made all along. And the conversations about how to measure it, I think we launched our QRS too late to benefit from the tiered self-assessment. So I think that as we think about in the future about revision, which probably won't be until 2018, that we'll be thinking about how to incorporate that more our indicators more closely back to the self-assessment. But for right now, the indicators are largely linked to the essential training. So that was our objective, is to measure the implementation of the content of each training.
Mm-hmm. And I know that Heather Hicks is on the line from Tennessee. Did you want to jump in about this conversation? I know you've been talking about parent engagement a lot in your QRIS, even though it's not specifically strengthening families language.
I will jump in here. I would like to say that we have a piece. We have that parent engagement portion of our QRIS. And right now it's really basic, but I think the more time that we have spent with it, and now that the self-assessment has come out tiered, I'm very excited about that, because we're hoping to have the parent engagement piece become deeper and not so surface. We want it to be something, I think, that people really recognize as being not just something that we're going to check off, but something that we're going to work at to really have that meaningful engagement with parents. So it's there, but as we begin talks around looking at our QRIS and possibly making changes in the future, our hope really is that we can make this a stronger piece and that has a lot more meat than it currently does.
Thank you. Does anyone else want to jump in on that? And Trish, were you able to find that question? I think Trish may be muted. Okay, I think I can find it. I'm going to read this question now that I found where to read it again. So it's, is accreditation included in the Strengthening Families Framework implementation in any QRIS system? The crosswalk that was done between the two indicates this would be mutually supportive. So I think that that is a reference to the crosswalk between NACI accreditation standards and the Strengthening Family Self-Assessment. Does anyone have a response on that? Jane, you referred to accreditation. Do you articulate how the Strengthening Families and Communities component feeds into that NACE accreditation?
Well, all of our, right, so national accreditation, NACE accreditation is just automatically accepted at the highest tier of our QRIS, but I think that that crosswalk really does show that that NACE programs, that's a priority for NACE programs, so we just know that they're engaging parents in a supportive and healthy and robust way.
Mm-hmm. Okay, does anyone want to talk about barriers you found to increasing parent engagement efforts?
I can speak to that a little bit. This is Jane.
Please do.
I think that one of the lessons that we've learned is how important technical assistance is to helping child care programs think and use the protective factors in dealing with families. So many families are under such a lot of stress, but child care programs and child care providers are also under a lot of stress. So I think that technical assistance is really a key to helping parents and providers come together in partnership around around difficult conversations and really connecting in a way that's meaningful. So I think technical assistance and having the time and the dollars to provide adequate technical assistance is a challenge.
Yeah.
If I can piggyback to what Jane said about technical assistance, I think that and this is Heather from Tennessee, I think that one of the benefits that we've had is to be able to go in and have technical assistance with early child care providers, but then to be able to say, if you're doing this with the protective factors, then you're supporting this part of the QRIS, and you're supporting this part of the assessment process. So being able to draw those connections and then just really help them see those connections to supporting each other, it's made a big difference.
Very good point. Does anyone else want to chime in? Okay, so I'm going to go on to my next question here. I don't see any more questions being typed in right now, but I do encourage you out there listening, feel free to type something in or raise your hand. So the last question I had written out here was, even if it's not part of the QRS, what other efforts are underway to increase parent engagement in early care and education programs? So this is both for the three of you who have already been talking about what's going on in your states, but also for folks on the phone. You could type in an answer or raise your hand and we'll unmute you, but we'll start with those who are already have been speaking. Are there other efforts underway to increase parent engagement? Well, I know there are. What are they?
This is Jane. In Idaho, we use I think, outreach through social media, through educational materials, through our licensing packet, and as people enroll to be subsidy.
Oops, did we just lose Jane? Oh, there you are. You're back. Hello? You cut out for a second, but you're back.
Oh, sorry. Even at when a program applies to be a subsidy provider, to start planting the seeds there for talking about partnership and engaging parents kind of on a level that people might not have considered. And so it starts with licensing and then goes through becoming a subsidy provider, and then every quality step along the way is to try to have some messaging around what it means to really team with parents.
Mm-hmm. And Erin, I know you had mentioned the role that Parent Cafe is playing in Wisconsin. Do you want to say a little bit about that?
Sure. So with Race to the Top, we supported a Parent Cafe initiative to where SFTA, Supporting Families Together Association, has said that they are willing to take on this task of reaching 625 parents throughout the next 2 years. We have Parent Cafes set currently in 10 different regions, or in 10 different counties. And this is sort of our pilot statewide initiative for 2015 because not all counties have participated prior to this. And so we're sort of allowing them a little bit of leeway. And then in 2016, they have promised, the same counties have promised to do 2 additional cafes, so for a total of 3 cafes in 10 regions, so 30 cafes in 2 years, and reaching 625 parents.
That's great. And each of those cafes you refer to, is that actually a series?
Yes, a
Okay.
series of cafes.
Great.
So we're saying 1 series, 3 sessions is how we're sort of talking about it here. And we were trained, everybody, the counties that are hosting the cafes were trained by Be Strong Family, Strengthening Families trainers. We came and had a 2-day training seminar with them to make sure that we're all to fidelity.
Great.
And all on the same page. The trainers were great. If anybody's interested, I think myself and SFTA would strongly recommend them. They were wonderful trainers.
Great. Yeah, Be Strong Families. Those of you who don't know, it grew out of Strengthening Families Illinois, and you can Google them. They're doing great work around Parent Cafe and other projects. And we had someone type in, I echo, Be Strong Families is wonderful. There you go. Thank you, Ruth. Okay, Heather, did you want to say anything else about other parent engagement efforts in Tennessee?
Sure. One of the ways that we're doing it is with our Child Care Resource and Referral Network. Our CCR&R specialists are spending time in child care settings offering to help model and connect with their parents. So we will go in and have a small like parent training or parent learning moment and offer to help our directors pull these meetings together. And so we're just trying to catch parents, pulling them in with us as kind of like that partnership with the child care setting. And it's working out quite nicely. We'll offer information on, we'll send out a survey, have the director send out a survey to their parents asking what information that they would like to have, what are they curious about, and then we'll help develop a really short 30-minute or so piece around that, and hopefully also they'll have something that they can take home and a strategy to use at home once they get back that they can use with their kids. So that's just one way a different way that we're trying to pull in that parent engagement from the opposite side.
Interesting. That's great. Thank you for sharing that.
Sure.
All right. Well, we haven't had any more questions typed in. I think you guys all shared such great information. We're not getting a lot of questions because not much was left uncovered. I think what we'll do is possibly wrap up a little early here unless anyone has anything else they wanted to throw in. Okay, well, I really appreciate our presenters, Erin Armbrost and Jane Zinc, and thank you, Heather Hicks, for jumping in as well. Thanks, everyone, for calling in, and I hope that this was useful for you as you think about your own quality rating and improvement system or other parent engagement efforts. Thanks, as always, for being part of the Strengthening Families Network, and we will look forward to talking next month. Have a great day, everybody.
Thanks, Kaylin.
Thank you.